Hello, my name's David Williams. I'm a consultant in obstetric medicine and honorary senior lecturer in maternal medicine here at the Institute for Women's Health. I specialise in the clinical management of medical disorders in pregnancy, and my group are investigating the pathophysiology of gestational syndromes. In particular, we're interested in preeclampsia. So one of my PhDs, Agata Ledvicic, is studying how maternal immune tolerance links with autoimmunity and vascular activity in the etiology of preeclampsia. Agata is funded by a UCL Impact studentship and co-funded by GlaxoSmithKline and Alea. We have another group led by Tamara Kuba, Alice Hurrell and Lucy Flanders, investigating in vivo vasoreactivity of serum from women with preeclampsia, trying to understand what causes the blood vessels to constrict to cause the hypertension of preeclampsia, and to target therapies against that. Myself, I'm also Chief Clinical Investigator of the STAMP trial, which is a multi-centre randomised placebo-controlled trial of pravastatin to ameliorate preeclampsia, and we're approaching the end of that multi-centre study now, and should have the results at the end of this year. I'm also chairman of the topic expert group of the management of hypertension in pregnancy for NICE, having been on the NICE guideline for hypertension in pregnancy. We are also studying the pathogenesis of fetal growth restriction, and Sarah Hillman is an obstetrician who's just completed her PhD with me and found, interestingly, that men who father growth-restricted offspring are more likely to be insulin resistant and pre-diabetic than the men who father normal grown babies. We've been looking at the genetics and epigenetics of this phenomenon, and this is part of ongoing work. Also, a third PhD working with me is Mandeep Kalla. She is investigating the pathogenesis of acute fatty liver of pregnancy, looking at the genetics, the pathophysiology and functional studies that may predispose to this devastating condition. And then finally, another group, we're looking at how gestational syndromes like preeclampsia and gestational diabetes predict the future health of the mother, and also, interestingly, the father and offspring of affected pregnancies.